So your period isn't here yet and you've run a pregnancy test and you're not pregnant either. What could be going on? You may have an irregular menstrual cycle. So irregular periods or cycles happen from different causes ranging from hormonal imbalances to medical conditions, some more serious than the others. So how do you know you have an irregular menstrual cycle? That's if you have less than 9 periods in a whole year, you miss 3 periods in a row, your menstrual cycle length is less than 21 days or more than 35 days. You have periods that last for more than 8 days. Your menstrual cycle length, that is the time from one period to the other, varies a lot, usually with at least more than 7 to 9 days. So for example, you have 28 days this month, after it comes 36 days, then you have 26 days, and then you have 34 days after that, just like that. And for girls starting out, that would be not having periods by the age of 16. No more than 3 years after her period starts, she has cycle lengths longer than 90 days, less than 21 days, and more than 45 days. So all of these can be seen as irregular menstrual cycles. It's definitely Young here again, the health teacher, and I'll be explaining 13 possible causes of irregular menstrual cycles, how they happen, what you can do, and when to visit the clinic. So are there instances where irregular cycles can be normal? Yes, of course, and these are during major transitions in a woman's life. So you have puberty. A few years after a girl starts her periods, she may have periods 1 month and nothing happens in the next 1 month or 2, and then shortly after that it's back again. It can stay this way until about 2 to 3 years, then it becomes regular. You also have menopausal transition, the time between a woman's reproductive years and menopause. Women experience this differently. Some women in their 50s, while some others may experience it in their 40s or even mid-30s. In this case, it can be referred to as early perimenopause. How and why does this happen? At this stage in a woman's life, she has fluctuating levels of the estrogen hormone. You remember the estrogen hormone, right? I talk about it a lot. It is the most famous female sex hormone, and it plays a very important role in the menstrual cycle. So in the first phase of your menstrual cycle, just before ovulation, estrogen is high. So basically, ovulation happens as quickly as your body reaches its estrogen threshold. That is its peak. At that point, the brain is signaled to produce the luteinizing hormone, which then triggers ovulation. And ovulation is necessary for the next period if a pregnancy does not occur. So if estrogen levels are dropping because a woman is at this stage in her life, it then affects the whole process, and as a result, there may be significant changes in the length of her menstrual cycle, because it just may take her body longer to reach this estrogen threshold, or it may not even reach this threshold at all, and as such, ovulation will not occur. So simply put, no ovulation, that is the release of an egg, no periods. So a lady may also have what you call anovulatory cycles in which ovulation does not occur, and all this may come alongside menopausal symptoms. So once a lady experiences this and doesn't see her period for 12 consecutive months, one can then say she's in menopause. Yeah. The next is pregnancy. So through your menstrual cycle, the endometrium changes in structure. It builds up to be strong enough for the embryo and placenta to attach if a pregnancy does occur. So your period comes when this endometrial lining sheds because fertilization did not occur. Now, when you're pregnant, your period stops automatically. Now, that's because you need the endometrium. The next is lactation. So with breastfeeding comes lactational amenorrhea. In some women, the first 6 months, there's no period at all. However, some who do see their period while breastfeeding may notice irregularities, like spotting, shorter or longer period, missed periods in some months. Like I always say, women are unique. Some others likely wouldn't even see their period for many months or even years. Now, yours will definitely depend on how often you nurse your baby, and of course, your body's interaction with hormones. The next is stress. I know you've heard it many times. You complain of irregular cycles and someone asks you, are you stressed? Or you're trying to have a baby and they say, wow, you have to reduce your stress levels, and you go like, stress, wondering how this happens, or if you're actually stressed enough to the point where your period now has to become irregular. You just don't understand how it happens. So I'll just quickly explain how this happens. Now, the hypothalamus, a very small portion of your brain, controls many activities happening in your body. These activities include regulating your heart rate, your blood pressure, and even your temperature, amongst others. It also produces hormones that either start or stop the production of other hormones in the body. So I'm really not going to make this complicated at all. I'll just tell you how it affects your menstrual cycle, straight to the point, and that's it. So the hypothalamus produces a hormone called gonadotropin releasing hormone. I hope I pronounced it right. Now this is the hormone that causes the pituitary gland to produce LH, luteinizing hormone, FSH as well, follicle stimulating hormone, that stimulate the maturity and the release of the eggs from the ovaries. Now these hormones stimulate the release also of estrogen and progesterone. The same hypothalamus also produces another hormone called corticotropin releasing hormone, which leads to the production of the cortisol hormone, that is a stress hormone. Now increased levels of these hormones can suppress the reproductive hormones, the release of the reproductive hormones. So your body would prioritize the production of stress hormones over reproductive hormones, because as far as it's concerned, you're in trouble and it's trying to help you. And when this happens, you notice that ovulation will be delayed, or it wouldn't even happen at all. Stress can be exercising too much, work stress, that job that's almost driving you crazy. I've experienced it firsthand at some point in my life, and I know what work stress feels like. It's a lot. Now, even eating too little, your body recognizes that as stress at all. You have to manage your stress levels in order to have a regular menstrual cycle. So some people listen to music, some others play games, watch movies, or even do yoga. There's been a lot of studies with results confirming that yoga actually reduces stress levels. So you might want to try that. And then I'm curious, how do you manage stress? Tell us in the comment section. You might be helping someone out there. You also have hormonal birth control. So basically, this works either of three ways. Either it prevents ovulation from happening. Of course, if there's no ovulation, there will be no egg for fertilization, hence no pregnancy. It also prevents the sperm from meeting the egg, and this would usually happen by thickening the cervical mucus at the neck of the womb, making it less conducive for sperm to travel from the vagina all the way to the uterus. And lastly, it can thin the uterine lining, preventing a fertilized egg from being implanted. So hormonal birth control comes in different forms. It could be a pill, an implant, injection, vaginal ring, or an IUD. So depending on which you use, it can cause irregularities with your cycle for the first few months. So the pill would usually come in a combination of estrogen and progestin, or progestin only. This combination pill will prevent ovulation, and progestin will thin the endometrial lining, thickening the cervical mucus. So if the lining is thin, there will be nothing to shed as period when it comes to these pills. So there are some with 21 or 24 active pills and 7 or 4 inactive pills, basically just placebos. So these active pills would keep your body in a constant state of thinking ovulation has occurred. These active pills are taken first, and then the inactive pills are taken afterwards. So this would now reduce the levels of the hormone in the body, and in turn would cause a breakthrough bleeding. So some women go on active pills for much longer. For these women, there will be no periods at all, until it is discontinued. I hope I haven't gotten you confused, so just go back and replay. You get it, I promise. With options like the implant or injection, your periods can even stop completely after a while. So, with this form of birth control comes irregular periods. But whatever option you choose, these irregularities will usually clear up within 3 months. If it doesn't, or you experience unbearable side effects even after this time, that is 3 months, please contact your healthcare provider. You can always change to a better option with less side effects. Let me know in the comments if you'd like to see videos about birth control. What do you want to learn? Or questions you have, because I'm putting something together already just to be sure it's the right fit for you. Now, you have extreme or intense exercise. Exercise isn't bad. As a matter of fact, it's very essential for healthy living. Exercise burns calories, perfect, but you need an energy balance to keep your body's processes working. When you burn too much, your body will not have enough energy to run these processes, and one of them is ovulation. So your body will prioritize some processes over others, just like I explained earlier with stress. So it will see the production of reproductive hormones as non-essential. There's more important stuff to deal with. And so it's no surprise that research has shown that over 60% of female athletes have to deal with irregular periods, either missed or late periods. Some have even stopped seeing their period totally. So check it. You may have just moved from doing 10 to 20 minutes of exercise or doing none at all to doing 60 minutes a day because you're desperate to get that body. That may just be what's affecting your periods. The key is balance. Find the balance, exercise moderately, and eat well too. Next is PCOS, polycystic ovary syndrome. This is a hormonal disorder common amongst women of reproductive ages, and irregular periods is a symptom. So women with this condition may also have elevated levels of the male hormone testosterone, resulting in physical signs like acne, excess hair on the face and body. These women may see that their cycle lasts longer than 35 days. For some women, it may be up to 40, 50 days, or even more between periods, and I'll explain how this happens. So your ovaries contain all the eggs you need in your lifetime. As a matter of fact, when you get this born, she has about 1 to 2 million eggs. So these immature eggs are stored in fluid-filled sacs called follicles, where they grow to maturity. At the beginning of the menstrual cycle, a woman may have as many as 1,000 eggs begin to mature, but only one egg will reach its fully mature state for ovulation. The remaining will die in a process called atresia. So remember, the follicle stimulating hormone causes the egg to mature, and then the luteinizing hormone causes the release of the egg from the follicles in ovulation. So when a woman has PCOS, there's usually low levels of the follicle stimulating hormone, high levels of the luteinizing, estrogen, and testosterone hormone going into the bloodstream, disrupting the normal process. So what you see happen is the follicles will not be able to mature, ovulation will not occur, and instead of the remaining follicles to dissolve, they turn into fluid-filled sacs called cysts. So when you do an ultrasound, you see your ovaries looking something like this with dark holes. These are multiple cysts in the ovaries. Most women with this condition tend to suffer from what they call anovulatory infertility. Infertility happening as a result of the fact that ovulation does not occur. So when the period finally comes, it can be really heavy. You notice I said most women. That's because some others will ovulate from time to time. The next is thyroid problems. The thyroid gland is located just below your Adam's apple. This gland controls several activities in the body, including your menstrual cycle. It produces the thyroid hormone. Too much or too little of this hormone can cause menstrual cycle irregularities, irregular periods, no periods at all, or too heavy periods. The next is hyperprolactinemia. So simply put, it's too much prolactin in the blood of women who are not pregnant or breastfeeding. It's a condition that can result from the previous point I mentioned earlier. So when there's low production of the thyroid hormones, it will lead to an increase in the production of prolactin. Now, prolactin is a hormone that causes the breast to grow, develop, and also stimulates the production of breast milk. Too much prolactin in the blood can suppress ovulation. In some women who have this condition, they experience nipple discharge. As a matter of fact, when women report to the clinic and complain of nipple discharge, one question they get asked first is if they have regular menstrual cycles, regular periods. It's usually as a result, of the hormonal imbalance. I guess you now know the reason why breastfeeding mothers do not have their monthly cycles. Next is medications. Medications like antipsychotics, anti-epileptics, blood pressure drugs, cancer therapy drugs can cause irregular menstrual cycles. Overweight as well. Being overweight would affect hormone levels, which would in turn affect your menstrual cycle. So gaining a lot of weight in a short period of time can have the same effect. You want to stay active and eat a healthy diet. And lastly is sleep. So there's something called circadian rhythms. It's a range of physiological and behavioral changes that follow a 24-hour clock. It's believed that nearly every human cell in the body has a biological clock. These rhythms influence very important bodily functions, like sleep, your temperature, your mood, even the release of hormones, among several others. The most common rhythm is the sleep-wake cycle, which is directly, connected with day and night. You wonder why it's late, your body automatically wants to go into sleep mode, and then hours later when it's bright, you wake up. A normal sleep-wake cycle will ensure that you sleep very well, and not only that, you'll also have enough energy during the day to go about your day-to-day activities as well. So when you're not sleeping well, your body sees that stress. You remember I discussed earlier how stress affects your menstrual cycle. Your body will prioritize the production of cortisol, the stress hormone, over your reproductive hormones that ensure a normal menstrual cycle. And when that happens, you begin to notice irregularities with your menstrual cycle. The circadian rhythm is a real thing, and its disruption have been studied in women of reproductive ages severally, especially in shift workers who work mostly at night, and results has shown menstruation disorders. Girl, you need to sleep very well. Irregularities need to be caught early and treated or managed, to prevent complications. Complications can range from diabetes to endometrial cancer, cervical cancer, and the most common, infertility. So don't sit in your house and say, my cycle isn't always regular. After a few months, to come back to normal. That's not good enough. You also have to know what is normal for you first to be able to catch an irregularity early enough. I mean, if you do not know your average menstrual cycle length, for example, how then will you know if your cycle is within the normal range or if there are any other irregularities? You do that by mastering your menstrual cycle. I can't count how many times I've asked ladies about their menstrual cycle lengths when they come complaining of irregularities, and I hear things like 4 days, 5 days. Your menstrual cycle length is different from your length of flow, how long you flow, it's different. These are basic things you should know. It's called body literacy. It would save you a lot of stress. Now, once you think you experience irregularities, visit the clinic for proper diagnosis and treatment or management, as the case may be. If you'd like to book a consultation with a gynecologist, you can book one with us wherever you are, and you'll be sure to get the care you need. Or better still, just walk into the nearest clinic with a gynecologist, OBGYN, close to where you are. There are several videos and articles I've put together teaching how to chart your menstrual cycle in the past using different methods. I'll link them just below. You can check them out. There's also my basic course for beginners, Chart Your Menstrual Cycle. You can start your journey from there if you're confused, not knowing where to start. You're trying to conceive, or you just want to monitor your reproductive health. More details are just below this link. It will help you very much. So don't forget to drop your comments, your questions. I'll check them out and get back to you. Cheers.